Dr. Wendy, and this here is my friend Daisy. Have you ever noticed that your cat or your dog is scooting or licking his or her behind? If so, it could indicate that there's an anal gland or an anal sac problem. What are the anal sacs and why do you need to know about them? That's basically what we're going to be discussing today. So dogs and cats, dogs like Daisy and cats like I said, they do have these anal glands or anal sacs that live in the back of the rear end, and I'm going to get her up so you can kind of see where they are. Come here, Daisy. Good girl. Good girl, Daisy. Good girl. So if you lift your dog's tail up, right at the 4 o'clock and 8 o'clock position, so approximately right here, that's where the anal glands or the anal sacs live. Basically, they're filled with an odorous, usually if they're healthy, a liquid secretion. Come here, Daisy. You can sit down now. Good girl. Most animals will just naturally release the secretion when they defecate. However, some dogs and cats have difficulty doing that. And when the glands get impacted, what ends up happening is the dog becomes uncomfortable or the cat becomes uncomfortable. You'll see scooting, licking. Sometimes the dog or the cat will chase their tail around. These could all indicate that the glands are full and that your pet is not expressing them the way they should. In which case, you'll need to contact your veterinarian or your groomer because they can very easily, either from the external area or the internal area, push the secretion out manually in order to empty the sac and make your pet feel better. As far as how regularly you need to do that, that would just depend on your individual pet. Some animals only need it done once in a while. Some animals will need it done many times in order to solve the problem. And basically, it's just up to you to look for the symptoms like the licking and the scooting to see if it would need to be repeated again. What would happen if you just left them alone and didn't do anything? Basically, the anal sacs can get very impacted. Eventually, the secretion will build up in there, it will thicken, and it can cause an infection. If an infection occurs in the anal sac or the anal gland, it usually requires a little bit more intensive medical treatment. Sometimes you need a minor surgery or a drain in order to repair the abscess, and almost always would you need an antibiotic. So the best thing to do is just keep on top of it to make sure that your dog or cat does get attention if you do notice that the anal sacs may be problematic for him or her. What do you do if your animal just develops chronic anal sac issues? Sometimes it turns out that the animal, maybe for one reason or the other, is just not able to express the glands very well on their own anymore, and you find yourself consistently going back to the veterinarian over and over again for the same problem. If that's the case, your veterinarian may recommend a special food, usually a food that's high in fiber, like I have right up here. There's many different kinds, mostly prescription, canned and dry foods that are high fiber sources. Your veterinarian may also recommend a fiber supplement. We have this with pumpkin in it. That's a source of high fiber. Here's another supplement. Or they might just recommend bran flakes or Metamucil. By adding the fiber into the diet, you're adding bulk into the diet, and that is going to help make a bulkier stool that should be able to push a little bit harder on the anal glands and give your pet the best chances of releasing those glands on their own. If that's not working, the next thing that your veterinarian might discuss with you in a very extreme situation is surgery. The surgery is where they remove the anal glands. It's a surgical procedure. It does come with some side effects to the surgery because there's a lot of nerves back in that area, so sometimes it can cause problems post-surgically, like fecal incontinence and things like that. So it's definitely a last resort, and if it is something that your vet feels like your pet needs, he or she will discuss that further with you. So I hope you found this helpful, and thank you very much.